It's commonly believed that stretching is always beneficial for back pain. However, both understretching and overstretching can exacerbate the condition. Understretching can lead to muscle tightness and reduced flexibility, contributing to pain and discomfort. On the other hand, overstretching can strain muscles and ligaments, causing further injury and worsening of symptoms. Bed rest is best. While rest may initially relieve back pain, prolonged bed rest can actually worsen the condition by causing muscle stiffness and weakening. In fact, staying active and engaging in gentle exercises can often speed up recovery and prevent future episodes of back pain. Pain equals damage. Experiencing back pain does not necessarily mean there is significant structural damage to the spine. In many cases, back pain is caused by muscle tension, poor posture, or inflammation rather than structural issues, like herniated discs or spinal abnormalities. Surgery is the only solution. While surgery may be necessary for some severe cases of back pain, it is often not the first or only option. Many individuals can find relief through conservative treatments such as physical therapy, chiropractic care, acupuncture, or medication. Surgery should typically be considered only after other treatments have been explored and failed. Poor posture is the sole cause. While poor posture can contribute to back pain, it is rarely the sole cause. Factors such as muscle imbalances, repetitive movements, obesity, stress, and genetic predispositions can all play a role in the development of back pain. Addressing these underlying factors holistically is often more effective than simply focusing on correcting posture. Pain is always physical. Back pain can be influenced by psychological and emotional factors as well. Stress, anxiety, depression, and unresolved emotional trauma can exacerbate or even cause back pain. Treating the physical symptoms without addressing these underlying emotional factors may result in incomplete relief or recurrent pain episodes. Therefore, a comprehensive approach that considers both physical and emotional well-being is essential for effective back pain management. In conclusion, understanding the truth behind common misconceptions about healing back pain is crucial for effective management and prevention. Remember, knowledge is power, and by dispelling these misconceptions, we aim to provide a more informed understanding of back pain and empower individuals to make informed decisions about their health and well-being.